Welcome to Hard Talk. I'm Stephen Sackur. While some countries are claiming success in their efforts to curb COVID-19, Brazil is increasingly looking like an outlier. The rate of new infections is still increasing, the death toll is mounting, and all the while President Jair Bolsonaro is focused on reopening the economy and easing social distancing measures. He fired his health minister after a series of disagreements, and my guest today is that health minister, Luiz Henrique Mandetta. Is President Bolsonaro putting his nation at risk? Luiz Henrique Mandetta, welcome to Hard Talk.
Okay, nice to hear from you. Nice to hear from England.
It is just 3 weeks or so since you were fired by President Bolsonaro. Now that you've had time to reflect on what happened, what are your emotions about it all?
Well, that's something that he is in charge. He was elected to hire ministers and to fire ministers. He had a view that the economic crisis would be much deeper if everybody would follow the health department on keeping distance and staying home. So that was pretty much confusing for the population, and he's in charge, so he decided to do it. I'm as a citizen now, I'm supporting the new Minister of Health, cheering for him to do a good job and trying to support the best decisions that they could make, and behaving as a citizen.
But Mr. Mandetta, the question is, really, if I may put it simply, what is going wrong in Brazil? Because we look at the figures today, well over 100,000 cases of infection according to the official figures, but according to unofficial estimates, the number of infections could be well over 1 million. Brazil could have, according to the University of Sao Paulo Medical School, the highest number of infections in the whole world. So what is going wrong?
Well, I think that people started, they just didn't want to keep on with staying home, and they decided to walk. Brazil is a whole continent. We are a very large country. We have 215 million people living here. So it's natural that we have more cases than countries that are, small countries like Portugal or Greece. And they are in whole Europe. Brazil is larger than the whole Europe itself. So it's not fair to compare Brazil to small countries.
I understand the point you're making. Brazil is a very large country with a large population, but perhaps the thing that makes Brazil so very different from countries like Germany or South Korea, who have successfully controlled and curbed COVID-19, the difference is that Brazil is led by a president, Jair Bolsonaro, who from the very beginning has belittled the danger of COVID-19, calling it a little flu, sniffles. But more than that, he's encouraged his people to go back to work. He wants to see the lockdown relaxed, the social distancing eased as soon as possible. He goes to rallies without wearing a mask. He makes a point of shaking hands with people, taking selfies, abandoning social distancing. The president himself must bear responsibility, surely.
Well, I'm sure that history is going to judge him, because that's exactly as you said. But this is not something that a society makes the decision going for only one people's mind. I mean, the press here makes a wonderful job. We've been watching everything that has been happening all around the world since China started releasing the images, but mostly when we saw Italy, Spain, France, even England, when we saw the nurses with bags on their heads to protect themselves without protection equipment, and we saw many politicians dealing with that, and in a way that they didn't know exactly how to balance the health and the economy. And even today, this is a challenge for many many heads of states all over the world. Bolsonaro made his statement, and very clearly he decided for the economy, which brought me into collision to my position as a Minister of Health. So, but it's his right. He's in charge. He was elected to it. We're going to have elections in a couple of years, so people will be able to judge and say if they understood that or not. I think that we have more than Bolsonaro. We have more than him.
Mr. Mandetta.
We have more than him. We have some governors of states. We have majors that also had this kind of behavior.
The bottom line is, as you've just said it, Bolsonaro is in charge. Bolsonaro has set the course and he has delivered the message from the very top. Does Mr. Bolsonaro, in your opinion, have blood on his hands right now?
I wouldn't put it this way, because it wouldn't help anything in the situation that we are here in Brazil now. I think that the whole country is trying to make its best in the health department, and also trying to bring a clear message that people have to take care of their parents, grandparents, and elderly people, and also have to take care of the health system. He's one voice. He's not the single voice in this country. We have the parliament open, we have the Supreme Court open, everybody is talking about it, and he's one person that what he's saying, when you look at the polls, people has been very careful to listen just for him. But no doubt that he'll be responsible as time goes by. I think that the cases are just starting to get high here. We are now entering the season where we have the respiratory syndromes in the South Hemisphere, and in Brazil the highest season for flu is June, July, and August. So we are just getting into the hottest time that we are going to pass through. So I think that his message is very confusing for people. I think that people didn't trust as much as we needed them to trust, mainly because of the social aspects of a country, that people live from the city, they live from what is and the social security didn't arrive for them in the right time. But he will take this for his account, no doubt about that.
I want to ask you a personal question. You had many meetings with him, and I'm wondering why you did not quit sooner, because there was a period in March where it seems he was leaving you out of some of the most important meetings about how to handle coronavirus. He was humiliating you in public by completely opposing your message about being strict on social distancing. He was saying, forget about it, we need to keep the economy moving. Why didn't you quit sooner?
First, because a physician never abandons a patient, and that's something that I carry with me. But what I think is that by staying in office and making the statements that the health department needed to do, this debate helped many people to take a better judgment about whom to follow and how to behave. So I think that this was important for that period of time, that they needed to see that there was a different voice about the disease, about the problem of the disease.
Right. Well, you certainly delivered the message that COVID-19 needed taking seriously and that people needed to keep the social distance. But aren't you yourself culpable in one important way? You were the chief at the health ministry through the beginnings of the COVID-19 response, when Brazil's attitude to testing was woefully inadequate. And we now look at the latest figures which suggest that Brazil's ability to test its own population for COVID-19 is frankly pitiful. The United States does more than 30 times the number of tests that Brazil does, and that is why the University of Sao Paulo now believes that not only could you have 1.5 million cases in the population, which you don't even know about, but they say Brazil is going to be the global epicenter of the pandemic. And you must share some responsibility for that.
Yeah, no doubt. When the beginning, when China released the first cases and the World Health Organization said that that problem, it seemed to us here that the virus would be what we call here a heavy virus, a virus that didn't have much ability to really spread around. It seemed much more like a SARS in 2002 than a virus that would be so capable of spreading to people. So we paid carefully attention of how it was spreading around China. We only saw Wuhan, the only city that had the cases. All the other cities, even Peking, they didn't pass more than 2,000 cases. So it seemed like a virus that would be able to be controlled. Then when we saw Iran, then the whole damage that made in their health system, we said, oh, come on, Iran is probably, they are under a severe economic blockage. So maybe it's just the way things went there. But when we saw Italy, when we saw France, when we saw Spain, when we saw England, and then we paid attention to the United States, and the United States, Mr. Trump was very comfortable on saying that he would take care of that. We really thought that he had some kind of science that would be released soon. But then we saw New York going down, we saw California going down, Florida going down, Chicago going down. And since the beginning, we were trying to buy things, but you know, you are a rich country. Europe are rich countries. The United States, the private sector just went inside this market and they just bought everything, the masks, and they even took from one country to another. The masks, the ventilators, everything that you would need to buy from China. China was closed almost 35 days in the beginning of, and they just didn't sell. So we started to produce the tests here with Fiocruz, which is the one that we have, but it has, it's not only producing, it's the capability of making all the logistics and having the machines to read the tests. So even the machines to buy them and to put them inside the country were hard. But when I was leaving the Ministry of Health, we arranged by the PAHO, which is the Pan American Health Organization, 12 million tests of PCR-RT, and 10 million tests that we were able to buy in China of those
but Mr.
fast
Mandetta,
tests.
Mr. Mandetta,
but we kept close attention on how England was doing, and this kind of testing everybody wasn't even the goal in the beginning.
Right, but the question now, given where Brazil is today, with the possibility, given the failure of testing, the possibility that you already have 1.5 million people infected, and you have a president who is asking for the economy to be opened up, for social distancing to be relaxed, the question is, how bad could it get?
Well,
what's your feeling?
It could get as bad as the virus is going to spread it all over the country. And in the health system, there is no health system in the world that is able to take care of people on the same time going inside intensive care units. This is how bad it's going to be. But what we are going to watch is different cities, different stages, different places in Brazil and different times of this epidemic curve. We have down in the southeast Brazil, we have São Paulo and Rio de Janeiro. Rio de Janeiro is going to have a terrible time in the next 2 or 3 weeks because it's raising up, and Rio is such a city that it's, you have the sea, shore, and the mountains, and it's people very crowded to each other, even in a social way to do social distance is almost impossible in Rio. So we are going to watch different cities, different people having very large
stress. Interrupt for just a second on that question of Rio. You say it's going to get terrible. I read in the Brazilian press yesterday that there were scenes of crowds of people eating barbecue food outside without any social distancing, other crowds gathering outside metro stations. It seems that Brazilians, taking their lead from the president, are not taking social distancing seriously anymore. And that may lead to a national catastrophe. What can be done about it?
Well, we have to alert, we have to talk, we have to speak. And in Rio, you have the governor, you have the mayor, and they have responsibility because the Supreme Court decided that the responsibility to make the social distance work is from governors and mayors, that they are the ones that have they have the responsibility to do it. What we see in Rio is such a social figure that the favelas, how we call the slums, it's very hard. It's one of the cities with largest numbers of tuberculosis. So when you get a respiratory virus inside of it, and that's going to be very, very hard to deal with it. And we've been, this is not from now, this is something that Rio should have worked better since ever. So we are going to have very, very high prices for things that we didn't do in the past and that you're really going to need them now. We have some good things beside that. Our health system is the best system that stopped smoking in the last 30 years. Only 8% of the Brazilian society smokes, which is a big difference from the European society. Let's see if that plays any role. In those favelas, you have very young people, so let's see how is that going to work with them. But it's really going to be a very high level of stress in Rio, which is a pity.
And I want to ask about one other location, and that is the state of Amazonas, and in particular Manaus, the biggest city in that Amazon region. The mayor there has said that right now he feels like he's watching a horror movie. There are not enough spaces in the cemetery for all of the dead, and those people, activists who represent the indigenous peoples of the Amazon, say that they fear there is going to be a de facto genocide of indigenous peoples. Is the Brazilian government, in essence, saying it doesn't really care, or it doesn't care enough about the suffering of the indigenous peoples, because it seems the resources are simply not there to help these people?
Well, that is not true. The Amazon is larger than Europe, and people that has been living, and you have different Indians in different societies. You have people that really live in where they started their lives since ever. And Brazil is one of the countries that most spends money on health for Indians. We have helicopters, airplanes, we have physicians, we have nurses, that we have a health system that is devoted for the Indians. But the problem is that this disease is very hard. You have people that go inside those places where they live, religious people, people that go for mining, people that go for non-governmental organizations, they go there to try to help them and really expose them to virus. And Indians, since the Europeans arrived here, the respiratory virus and other viruses like measles and mumps, they really made a big damage to Indians. We are trying to keep them as isolated as we can. Then you have the Indians that live in towns, and they go back and forth. They go to their villages and then they go to town. Those are the hardest ones to take care, because they have to go inside the health system of the city, and sometimes they don't understand, or they don't even understand what is written. It is very hard, but you have a health system that really is really devoted to them. But the virus for Indians have always been a very hard task for them to pass through.
Right. We've discussed the health emergency in Brazil. Before we finish, we don't have much time, but before we finish, I want to ask you a couple of quick questions about the bigger picture. One is about the economy. President Bolsonaro's message, when he says, look, we have to get back to work, we have to ease the social distancing, we have to focus now on Brazil's economy. He says the people are desperate to get back to work. State governors should stop calling for the strict lockdown. He says the destruction of jobs by some governors in this country is irresponsible and unacceptable, and we are all going to pay a high price for it. Do you think he is right to, in essence, put economic priorities at the top of the agenda right now, despite the healthcare crisis?
No, I think he's completely wrong. That's why I was fired. I put life first, and I think that if we would be able to keep a better way to take care of people, the economy would respond much easier in a near future. But if we keep doing this kind of message and people decided to go to work and try to survive any way because the president is saying so, we are probably going to have a very deep health crisis, and which is going to make the economic crisis be even deeper. So we'll see what is going to happen. What we have to do now, the whole community, the press, and the health people from science, we are all talking with people and giving the message that, listen, it's better to slow down a little bit, let's pass through in a very slow motion, and then we will recover economy, which is going to be something that the world will have to do. The world will have to sit around the table and try to figure out a new way for the economies to work. Otherwise, we're going to have the damage of this virus would be much longer than the humanity needs to. So I've been working in the post-coronavirus crisis, trying to figure out how the world is going to work. Not only the health system, but also the economy, also the relations that we're going to have, to build in a different agenda. So, but I think that he's wrong. Yeah.
You say he is wrong. When he fired you, you said he hasn't just fired me, he's actually fired science. Since then, we've also had the Justice Minister announce his resignation because of political interference from the President. There is a sense of political crisis in Brasilia right now, and many of his critics are saying that Bolsonaro isn't fit for office, he should be impeached, that he is endangering the country. Do you believe that?
Well, we have a democratic society, and the impeachments were done in Brazil twice in the last 30 years for different reasons. As long as we have this kind of situation, we have a free parliament, a free society, I think that people is going to do what they have to do. But I really think that things are working. The democratic system, although we have this kind of noise, but the democratic system is working pretty well. A free press, a free freedom of speech, the parliament is open, the Senate is open, the Supreme Court is working. I mean,
but Mr. Mandetta, you say the system is working, but in the meantime, thousands and thousands of Brazilians are going to die of COVID-19, and many will say they're dying unnecessarily because of a failure of leadership at the top. Surely that is reason enough to question whether Bolsonaro should continue in office.
Yeah, well, if we were in a parliamentary political system like you have there, probably that would solve in a political way. And Brazil is not. We have elections each 4 years, and to have an impeachment, you really have to have a very well documented crime or something like that, and even have the political vote for it. But what I think that is for this time, it's not the best time to discuss that. We have a higher and very stronger enemy to deal with, which is the coronavirus in the Brazilian society. And that's where all of our energy has to be. We'll talk about politics later. Now, we really need everybody to help. Even you from BBC, by doing this interview, is helping a lot, and I appreciate what you're doing.
Luiz Henrique Mandetta, I thank you very much indeed for joining me from Brasilia. Thanks a lot.
Thank you.